Which is the correct sequence of lymphatic drainage? A. The exercises first focus on distal areas of the body to clear central collecting vessels and then involve proximal muscle groups to begin to move peripheral edema in a centripetal direction to the central lymph vessels. B. The exercises first focus on proximal areas of the body to clear peripheral collecting vessels and then involve distal muscle groups to begin to move central edema in a centripetal direction to the central lymph vessels. C. The exercises first focus on proximal areas of the body to clear central collecting vessels and then involve distal muscle groups to begin to move peripheral edema opposite to the centripetal direction towards the central lymph vessels. D. The exercises first focus on proximal areas of the body to clear central collecting vessels and then involve distal muscle groups to begin to move peripheral edema in a centripetal direction to the central lymph vessels. And the answer is D. The exercises first focus on proximal areas of the body to clear central collecting vessels and then involve distal muscle groups to begin to move peripheral edema in a centripetal direction to the central lymph vessels. Explanation for this question is, here's a detailed explanation of the correct sequence. 1. Focus on proximal areas of the body first. The exercises begin with proximal areas, which are closer to the body's core and central lymphatic vessels. This initial step helps to clear and prepare the central collecting vessels, ensuring that there is no obstruction or congestion in the main lymphatic pathways. 2. Clear central collecting vessels. By working on the proximal areas, the central collecting vessels are cleared, creating a vacuum-like effect. This vacuum helps to draw lymphatic fluid from the peripheral areas towards the central lymphatic vessels. 3. Involve distal muscle groups. After the central collecting vessels are cleared, the exercises then involve distal muscle groups, which are farther from the body's core. These exercises help to mobilize and move the peripheral edema, fluid accumulation, towards the central lymphatic vessels. 4. Move peripheral edema in a centripetal direction. The exercises involving the distal muscle groups are designed to move the peripheral edema in a centripetal direction, which means from the periphery towards the center of the body. This direction follows the natural flow of lymphatic fluid, which is unidirectional, moving from the peripheral tissues towards the central lymphatic ducts. 5. Drain towards central lymph vessels. By following this sequence, the peripheral edema is effectively drained and directed towards the central lymph vessels, which ultimately drain into the venous system near the heart, allowing the excess fluid to re-enter the cardiovascular circulation. It's important to note that the lymphatic drainage pathways in the body are interconnected, and most areas, except the head, right side of the chest, and right arm, drain towards the left shoulder region. Therefore, a comprehensive lymphatic drainage massage should include all areas to ensure proper drainage throughout the body.